Hi guys, good afternoon. My name is Solomon Domi. I am the head of research at the Brain and Body Foundation, and I am here with the head of physiotherapy unit. Ma, can you introduce yourself, Ma?
Good afternoon, everyone. My name is Mrs. Akhanbi. I'm the head of Physiotherapy Unit, Kubwa General Hospital.
All right, Ma. So, over time, we've been having discussions regarding patients that you refer to us. She's actually one of the persons that have referred the most patients to us from any medical practitioner, be it doctors, nurses, or allied medical practitioners, and we are grateful for that. But for some of our patients, we've just wanted to get your own view, your own vantage point about some of the supplements and how they've helped our the patients that we both see and we both try to help here at Kubwa General.
Okay. I would like to thank Brain and Body Foundation for the work you are doing. We really appreciate it, especially for these young children, because most of the parents cannot afford the kind of supplements you bring their way. I got to know about Brain and Body Foundation about, let's say, 3 4 years ago on Instagram. I just bumped into the page actually, and I got interested, went through the page. That was how I started sending patients to you at Wuse too. But they will keep complaining that because of the proximity of where they stay to your office and the transport fare. So I'm really happy. When was it, around March? You decided to start coming to Kubwa General Hospital, and I was informed. It's really like a weight off me, because I know these people, I mean the children in particular, they need the supplements, and you are here to provide it for them. And to talk about the supplements now, I've seen lots of improvements, great improvements on my patients. I call them my children because I see all of them as my children.
Yes, ma'am.
There's been lots of great improvements in them. Example is David. David was, he's still a CP patient actually. When I started treating him was around age of 1. David was not standing, no neck control, he couldn't sit, weak trunk muscles. But I thank God, after 3 years, the boy was able to walk, was able to start school. I've been, urging the mom, try and go to Brain and Body Foundation. But I understand that plight. She was the only one taking care of this boy. The father was not contributing a dime even to the boy's treatment, because he thought it's a child we are supposed to neglect. He even told me that I'm not supposed to be encouraging the mom to take care of the child. But when you came and I talked to her, I even called her on the phone that, Mommy David, please try and come. I want you to come and see these people now that they are here in Kubwa. And before you know it, within 2 3 months, she came here jumping, thanking me that David has really improved. Even his speech is now improved. He's doing well in class. The teachers are commending her. They're asking her what did she do that David is able to talk fluently now. He's walking
Wow.
properly and everything. But, well, I just have to thank you.
Yes,
That's
ma'am.
what I will say.
So for David, it's been okay. We started with brain and nerve. We have the supplement called brain and nerve,
Yes.
and then we give omega. So the
Yes.
combination of brain and nerve and omega, we saw it was I was shocked with some of the improvements. So another patient that has shocked me, she came in last week,
Okay.
Michelle Odogo.
Yes.
We gave her zinc and omega, and the mother was she came and she was talking about how it has helped. I
Yes,
don't
I
know.
remember Mitchell too. The mom was a bit skeptical then.
Wow.
I remembered when I first told her you go to Brain and Body Foundation. The first question she asked was, "Are you sure it's going to do anything? Will there be any improvement at all?" Because she has tried all sorts of supplements.
Wow.
Still, the child is like that. I just encourage us and give it a try, because I've, on my own, personally, after a month, I always ask them, have you seen any improvement? what can you tell me that maybe the child was not able to do before and is able to do now?
Wow.
And I can proudly say, like 95% of them came back telling me, no, the child is able to do this now, is able to do that now, this, and even Mitchell too. The mom came here and she was happy that thank God I listened to your advice, because I was a bit skeptical as in why should I try another supplement that won't work? But well, there's no loss because she's not paying for the supplement, so let her
Yeah.
just try it.
Yeah.
But thank God, she's happy, we are happy
Wow.
about the improvements we are seeing now.
So with just omega and zinc, we could
Yes,
achieve
it's
so
just
much
omega
improvement.
and zinc, yeah.
It's shocking, and we are grateful for how you've referred patients to us. And
Thank
one
you.
patient that comes to mind too, I don't feel to talk about this boy, Brian Asuzu,
Yes.
with brain and nerve and omega, and we saw. Can you talk
Yes.
about some of the improvements you yourself noticed with Brian
Well,
Asuzu?
Brian, before you call Brian, is not responsive.
Wow.
Though with the physiotherapy we do, the neck control, trunk muscles got better. He was able to sit on his own. But now, when you call Brian, after he has been on the supplement, and even before them, he was having seizures and all sorts. The mom too was like, no, with the other drugs the neurologist gave her, should she include the supplements? I told her, I said, go back to your pediatrician, which is Dr. Ejikoye, talk to her. And Dr. Ejikoye too assured her that there's no problem in using the supplements. She listened to both of us. She started the supplements. And now we are seeing improvements in the child. Not that it doesn't have the seizure again, but let me just say the time interval has reduced.
The frequency of
Like,
seizure,
yes, that
yes.
frequency of seizure that he used to have. Before it could be like once in 2 weeks, but now we see once, maybe once in 2 months, and
Wow.
the boy is really doing well. You understand? He's really doing well. He's trying to express himself these days.
So does he respond to your therapy better
He
than
is
before?
responding to therapy also. He would have been here today, but his mom gave birth
Yeah,
2 weeks
yeah,
ago.
she told me.
Yes, he would have been here today. Mom gave birth 3 weeks ago.
So
But
so on
Brian is doing
average,
well.
yes,
Another baby is Ebuka.
yes,
Before
Ebuka.
Ebuka started the supplements and everything, there's nothing we have not done,
Wow.
even physiotherapy. I can even say, I was becoming discouraged with his case that time. One of the most difficult cases we have handled here.
Wow.
The kind of case you treat, a patient you treat, and you're not really seeing that
Yes.
improvement you need to see in a child, and you become discouraged. Even the parents were discouraged as in what is going on. We keep referring him from one unit to the other. Let's see what is going on. There's still we know what is wrong with him. You understand? I just don't want to elaborate on it. But after the supplement, the first month I asked the aunt, because most times it's the aunt that brings him here. She said, ma, the supplement is good though. Ebuka now is trying to talk. Ebuka is trying to do this, do that. After 2 months, eye contact, eye tracking that we have been. I don't know whether it's your supplement now, but that's
Yes.
what I noticed. That
Yes, ma'am.
the eye tracking, the eye contact, Ebuka has not been able to achieve. He now has it. He can look at you directly. He tries to communicate with you.
Yes, ma'am.
You call him, he responds. He tries to play, unlike before that. I won't call him an autistic child because it was not brought here for autism.
Yes, ma'am.
But now, you know, he plays, he does everything. He too would have been here today, but he's not feeling fine.
Okay.
Ibuka is not feeling fine. I think he's under the weather. It's most of the children now because of this weather. But Ibuka has greatly improved. So I thank Dr. Ajibade. I thank you, his team,
Thank you.
for what you are doing for these children.
Yes, ma'am.
If not for your NGO, I don't know what these parents would have been going through. I can specifically tell you most of them cannot afford this.
Wow.
They cannot. We know how we send them. We just tell them, okay, try to get this one, get that one. But when they come back and tell us the price, even me, I'm discouraged. As in, where do they want to
Where
get
they
this
get the
money?
money? Yes, ma'am.
So
Wow.
we thank you.
Thank you very
We
much.
pray and we believe that you will still continue with
Continue.
us
Yes, ma'am.
for some time.
Yes, ma'am.
Let
Thank
our
you.
patients enjoy the benefits of your supplements.
Yes, ma'am. So for us, many of these patients, they are like a source of learning for us too. That
Okay.
we know that it is collaborative. We are
Yes.
we are always appreciative of both the neurologist's efforts, your efforts, because the physiotherapists, they are like, I would say you guys are the closest patient medical personnel to the parents and the children.
Yes.
And we are always grateful when we see results, when we add our supplements to what the neurologist is doing and what the physiotherapist is doing. And we will not take the
And
glory
even the
because,
pediatrician.
even the pediatrician, we will not take the glory because we know that this thing is a learning curve. And by
Yes.
saving these children and helping these children with some of the nutrients, we are also learning to help other children.
Yes.
So we are grateful because, like I said before, she's the unit has referred more patients to us than any other unit, and
Thank you.
she even referred patients to us when we were in Wuse. So she was even one of the driving forces for us to even think to come to Kubwa, because we knew that patients here would get help, because the medical personnel here, they would definitely send them to get help from us, and we are grateful for that, ma. Thank
Thank
you
you
very much
very
for your help,
much.
how you care for these children and how you refer them to us.
Thank you
Thank you
so
very much, ma.
much. Thank you.
So
God
guys, thank
bless
you
you.
very much. This is the head of physiotherapy unit, Solomon, signing out. Thank you.